Hi, my name is Thomas Cherin. I'm a liver specialist, more specifically a liver transplant surgeon. I run or founded South Asian Liver Institute, a dedicated liver center for patients with liver disease. Today I'm going to touch upon quite a delicate topic. I'm not saying that we are the best. I'm not saying you have to come to us. I am only trying to help patients whom I see suffering, whom I see with so much of confusion in their minds. I am just trying to help patients decide where to have their transplant. And once again, I am not saying you must come to me. What are the ways you can judge how good is a liver center? Well, I think there are few things that you can use. Everything is based on trust, and at some point we all have to trust others. But there's a few points that you could look at when you are thinking of having a liver operation or a liver transplant. The first thing is it should be multi-speciality. There is wisdom in collective wisdom in a whole lot of specialists talking about liver disease. For example, in our center we have a liver surgeon, we have a liver specialist liver anesthetist, we have a hepatologist, we have a critical care person, and therefore all of these people, we sit down and decide what is the best treatment for this patient. There is a problem with his heart, let's get a cardiology opinion. Therefore, 20 specialists giving an opinion, therefore leading to the best possible treatment for the patient. So, collective care, not a single person. Second thing is transparency. So when you go somewhere, they should be fairly open in terms of how they discuss what the problem is, what is the cause, and what is the treatment. Of course, in about 10 to 15% of cases, we don't know the cause of liver disease, and that is acceptable. But in general, we should have a plan, we should be able to carry it out, and we should have a frank discussion on what is the risk of this operation versus not having this treatment or operation. The third, I think, is talking to other patients who have been there before, patients who have had treatment under that center before, and that will give you a very good idea. But sometimes, don't forget, patients have had a death. That doesn't necessarily mean a center is bad. We are hospitals. Patients, despite our best efforts, can die, and that doesn't mean it's a bad hospital. But if everybody who goes there is dying, I guess there is a problem. So judge this very carefully and don't jump to conclusions. The fourth thing would be look at the approach to your care or your relative's care. Is it scientific? Is it based on evidence? So are they saying things like, we do it this way? Or are they saying, the current evidences, we have looked at this, we have looked at that. Last year we used to treat patients like this. Now there is a new disease, a new treatment, and therefore we're using this. That suggests that this is a team that is kept updated. So every week we have scientific and academic meetings at South Asian Liver Institute that makes us absolutely have to stay up to date with current liver medicine. And the last one I would say is, every decent liver center should have multiple options available. So for example, we have TACE, we have TARE, we have microwave ablation, we have liver resection, we have liver transplant. All of these options are available for patients here. So when a patient comes to South Asian, I don't have to choose microwave. I don't have to choose RFA because that's the only treatment that is available with us. I can choose what is the best treatment for this patient because all the treatments are available with us. So I think these are the few things that you can do to try and judge where to have your treatments done. Now, like I said before, this is a pure gesture meant to help patients, and I feel sorry for patients because at the time that they are sick, at the time that their loved ones are at a risk of death, there is so much confusion in their minds. Many of the liver units in this country is run by my friends and colleagues, and I have no issues with competition at all. I am simply trying to say these are the few things that bring out what is a good liver center, and hopefully it will help you choose the best place for treatment.